So now we're going to talk about the oropharyngeal suction as well as nasotracheal. So first we're going to go oropharyngeal. You are going to be using clean technique. You're going to apply the pulse oximeter to the patient, make sure that they are oxygenated. If not, you're going to want to hyperoxygenate them. You're also going to want to assess their lung sounds, make sure that they're sitting in a semi-Fowler's position. Then you're going to want to drape the patient. You're going to apply your PPE, and you're going to apply your clean gloves. Then you're going to have your normal saline and or sterile water. You're going to pour that into the provided container with your kit for suction. And then you are going to connect, you're going to also have a yonker. You're going to connect the suction with your clean gloves and the yonker, and you're going to check the suction, make sure that it is on and working. And then you are going to insert the catheter into the patient's mouth along the gum lines and to the oropharyngeal area, oropharynx, to suction the secretions. And then you are going to suction some of that normal saline or sterile water through the yonker to clear the tubing. Then you are going to turn off the suctioning, and you are going to wash the patient's face off and provide any oral care. And then for the nasotracheal suctioning, you are going to first want to make sure that you check the patient for any contraindications like bleeding or the laryngeal spasm or hepatitis. And then you're going to apply the pulse oximeter, semi-Fowler's position again. You're going to apply your PPE. You're going to connect the suctioning, test the suctioning, make sure that you have your sterile water, and then you're going to also have a sterile or water-soluble lubrication. You are going to apply your sterile gloves, and then you are going to get your catheter you're in your dominant hand. So, and then also be on, if you're right-handed, be on the right side of the patient, left-handed, be on the left side of the patient. Going to have the catheter in the right hand, and you're going to connect the catheter with your left hand to the non-sterile tubing with the suctioning. And you're going to then coat the catheter with the lubricant, and you're going to ask the patient to, will actually have a safe signal. So if something is hurting or something's just not right for the patient, ask them to like raise their hand or something, tell them that it is going to feel a little bit uncomfortable. So you're going to ask them to inhale, and you're going to insert while they're inhaling gently and quickly. And if the patient resists, or if the catheter is resisting your insertion, you're going to pull back just a couple inches. And you're going to want to insert the catheter about 8 inches for adults, 6 to 8 inches for 6 to 8-year-olds, and then for 3 to 5-year-olds about 3 to 5 inches, and then for infants about 1.5 to 3 inches. So then you're going to actually have the patient turn right or left while you're suctioning, and this is going to assist suctioning deep into the bronchus. So if when you're doing your suctioning, you want to make sure that you're only doing about 15 seconds, and you're going to do it intermittently. You're not going to be suctioning while you're going inserting into the patient. And then so you're going to want to do also is circular, if you can do circular motion when you're pulling the intermittent suction out of the patient. And then you're going to encourage the patient to cough and bring up any secretions that they might be able to on their own. And then you're going to replace the oxygen and assess the patient. So like before, you would have already assessed the patient's lung sounds prior, and then you're going to assess them again to verify that the suctioning was effective. And in order to dispose of all of your apparatus, you are going to, when you pull the catheter out of the patient, you're going to want to coil it into your dominant hand that's holding it into the glove, and you're going to wrap that up in your glove. And then make sure that you assess the patient's oxygenation and replace any O2 that the patient may need, and that's going to be it.